Fatigue is a normal feeling of getting tired or lack in energy after doing a lot of hard work, as if your eyes are getting tired. You land up on the bed directly after a long period of work. Hi everyone, welcome to my YouTube channel again. This is my first video with the face on, and the rest of the videos are faceless. So I was speaking on the symptom called fatigue. Fatigue is a normal symptom. It happens with everyone. When you're tired after doing a lot of work in office or in school or in college, whatever work you're doing, may it be household work, you will feel tired after that. And if you're doing it for a longer time, then the most common symptom which occurs is fatigue. Even after doing a strenuous exercise, any kind of exercise, let it be HIIT, high intensity kind, or even your small yoga or breathing exercise can lead you to some little kind of tiredness or fatigue. So I was saying on fatigue, if you're getting persistently tired, not just by doing some work or by some other activity, but it is very persistent for a longer duration, even after prolonged hours of periods of work, you're doing it and you're getting the common symptom again and again, you're feeling tired. Daily, you're saying for a week, for a 2 weeks, for a month, you keep on saying this that you're feeling tired and fatigued. So, this symptom, this thing is not normal, so it doesn't become the normal symptom. It turns out to be an abnormal one. That diseases which will include prior to you seeing a doctor first. Firstly, whenever this persistence of fatigue occur, the first thing the physician or the clinician will notice is anemia. They'll seek for any kind of pallor in you, or whether you have low HB levels, your hemoglobin levels, or any kind of vitamin deficiency. So first thing is anemia in case of anemia. Then if there is any physiological change within you, like if there is pregnancy state for a woman, so she will easily get tired because she has to bear the child as well. And she needs energy for that, and she has to add herself with extra energy. So that is one physiological condition where in pregnancy you will feel tired. Then in anemia you will feel tired. Now let's come to cellular changes. If there are any cellular changes like sickle cell disease, then also even in case of leukemia, then also you may feel tired. In sickle cell disease, what happens is the cells are turning into sickle shaped and they are degenerating. The red blood cells, which are carrying the hemoglobin molecules, so these are degenerated. As in case of leukemia, the white blood cells counts are increasing. Even in that, the RBC levels will remain the same or may not remain the same, but the WC count will decrease. That is leukocytosis. So that is another cellular deformity in which you can feel tired and fatigued. So I stated about anemia, then pregnancy, and cellular states like sickle cell disease and CKD. No, not CKD, leukemia. Next comes is about any pathological change. If there is any inflammation within your body, like any systemic infections like TB or in IBD, irritable bowel disorders, or any kind of underlying disease, which is hampering you. May it be anything. It could be pancreatitis too, or even in fact immunodeficiency states like HIV. So these states lead you to fatigue. And if you are recovering from some kind of disease like TB or any of these which I mentioned earlier, that time also you're feeling tired, you do not have any energy to do any work. Even after some kind of chronic disease itself gives you fatigue. Let it be any disease. And if the disease is underlying within you, it is definitely going to give you fatigue. So you need to check all these parameters if these are with you. If this fatigue persistent symptom is there with you, then comes is if there is metabolic change, like in case of diabetes. In diabetes, you feel thirsty and frequent urination, polyuria. So in case of diabetes also, you will feel fatigue. So this frequency of going for frequent urination or drinking water, feeling thirsty, that can lead you to fatigue. Yes. Yeah, I know this word fatigue is coming common because it's the symptom which we are discussing today. Next comes in case if you're trying to concentrate for a longer time. Yes, I just checked. If you're trying to concentrate for a longer time and you're with lack of sleep, just like insomnia, lack of sleep, you're spending sleepless night. That time also your body needs rest. This everybody knows. Your body needs rest, it needs sleep, and without it you cannot perform the other day. So you'll feel fatigue if you're having lack of sleep. That's it. And another thing which I could say is on being depressed. In depression also you'll feel fatigue. You can check my video on depression in the symptom series. Another one thing is there was a video which went viral recently where a doctor went for a treatment for COVID to it was some place, and he was so much tired after doing 24 hours and 48 hours of work that he collapsed himself in the lift itself, and then he regained again. Then again he went with all his consciousness, he went ahead from the lift door to the parking lot, and then again he collapsed himself because he had overly worked and he damaged while he slipped down again in the parking lot. He damaged himself and he injured his face. He had broken his teeth. So people from the hospital helped him up and recover back. So he was not resting. So restless syndrome will come into scene. Then again, chronic fatigue syndrome also, that too. I think that's for today. Yes, even after COVID, people were feeling fatigued all these while. They were doing breathing exercises, helping with the recovery of their lungs and other tissues of their body.